that's really it on hiring practices. The last thing I mentioned here kind of segues into substance abuse programs. I do recommend pre-employment drug screens. It is a deterrent for applicants that struggle with substance abuse. All employees get tested, unlike the pre-employment physicals. Everybody, whether that's office staff, uh, any job title in the entire organization, including management, gets tested. And it is an integral component of your company's substance abuse program. We are going to dive into this in a lot more detail as we jump into substance abuse programs. And again, the reason they're kind of redundant here is because a lot of times I have these as standalones. But when we talk about, well, first of all, any other questions? Thank you again. That was a very good question regarding the legalities of that. But any other questions regarding basic hiring practices? Nothing there is airtight. Trust me, it's just little. If we do a lot of little things, it reduces risk. And so if you do all those little things and the work history and check the references and bring them in for an interview and all those little things, it reduces our risk. And in my opinion, the hiring practice substance abuse risks tend to be bigger risks because they could lead to bigger claims and bigger problems. So any other questions on hiring practices, onboarding process? Okay. Substance abuse programs. This is a big one. We work in an industry that is physically challenging. We work in an area of the world that is expensive. It's stressful. The work we do sometimes is seasonal, so you don't have a steady paycheck. And a lot of time, and there's just a massive push, and this even started before COVID in the industry nationally, and COVID kind of even magnified it and pushed to the forefront even quicker. But you know, as an industry, we tend to turn to alcohol and substances frequently, as evidenced by this statistic right here. 1/3, 1 out of 3 of all incidents on construction job sites are drug or alcohol related. Companies with a substance abuse program in place that is comprehensive, strong, which we'll describe, are more than 60% safer than those without an implemented program. Okay, that's big numbers. 1 out of 3. If you said, hey, I have a strong program versus I don't have a strong program, and I could cut down my incidents and likely serious incidents by 60%, would you do it? Absolutely. And it's not a massive undertaking. It's fairly simplistic. Okay. The hardest part is the documentation and enforcement. But having a strong substance abuse program, I missed a slide there. There we go. I'm backwards on these. Having a strong substance abuse program is integral. It is very important to your risk levels. This is ABC National. This is a table that I pulled from ABC National data a few years ago. It's the same. I haven't changed the slides. The high score, low score at the bottom of the graph there might have been different, but the percentages have not changed. This is a graph that represents, I think last I heard it was like 1.2 billion man hours. And what this is a graph that represents your total recordable incident rate, so OSHA documentation incident rates, TRIR is in blue, and your DART rate, which refers to any incident that results in either missed time or light duty, so the more egregious injuries. And compares that to national data with how ABC employers score themselves on substance abuse programs. If they have a high score, meaning they have a comprehensive program, meaning we have the 3 pieces in place, which I'll talk about, testing, policy, AAP, if they have those in place versus don't have those in place. So companies that do have a comprehensive program in place have a 69% reduction in their total incident rate and a 68% reduction in their DART rate. Okay, these are real numbers. These are numbers based on a lot of data. So it works. It absolutely works. So what are the components of an effective program? One is your testing component. This is how ABC would define comprehensive. So the 3 levels of testing that are mandatory, or I would say mandatory integral, would be post-accident, pre-hire, and reasonable suspicion. I'm going to make a strong case for random here in a second. A policy with strict rules regarding drug and alcohol use, supervising, training, record keeping, and active enforcement, and an EAP with available education on substance abuse prevention. Okay. So let's talk about, oops, I put the wrong slide in there. My apologies. That's the same slide as before. There we go. Let's talk about testing. 3 levels that ABC would say are integral is post-accident, pretty self-explanatory. Something happens, they're going to a clinic, require that panel of drug testing. Pre-employment, we talked about this in hiring practices. Everybody gets tested before coming into your organization, regardless of job title. Okay. The one thing I want to mention there is it started in 2024, and it's a very loosely written law, but it just says you, the employer, cannot discriminate against somebody who tests positive in a pre-employment test for marijuana. Okay. It doesn't mean you have to hire them. It means you can't discriminate them in the process just because they have a positive marijuana test, since that is a legal drug. Basically, what the law is trying to accomplish is saying, give them the opportunity to adhere and abide by your company's drug policy. Just because they did something last weekend or the night before should not preclude them from the process, is what that law states. Okay. It doesn't mean you need to change your policy. And when this law first came out, I had a lot of questions on that. You can keep your policy. If you have a zero tolerance for THC, you absolutely can. We'll get into this in a second. But it means what you can't do is discriminate in the hiring process against somebody who tests positive for THC or for marijuana. That make sense? Okay. So post-accident, pre-employment, reasonable suspicion. This involves some training for your supervisor staff. Basics. You can find this online. Slurred speech, diminished motor skills, dilated pupils, et cetera, et cetera. Now, this has actually saved a couple lives since I've been in this position at Aspire. I've had 2 different employers go through this reasonable suspicion training with their supervisors, and there were 2 instances where a supervisor recognized diminished motor skills and slurred speech, told the worker, hey, I think we need to get you in and get you tested. And it wasn't because of substances, because someone was having a stroke. Maybe someone, and the other one was there was issues with blood sugar levels and diabetic. And actually, the story I got is it actually saved 2 lives. So there is a positive side of that as well. But reasonable suspicion, again, self-explanatory. You see something, let's get them in and get them tested. Don't just turn and look the other way and let them go work with power tools, work with heights, et cetera, et cetera. The last one that I'm going to make a case for is random testing. I have a lot of companies that don't do it, and then I ask why. They say we don't want to spend the time, money, and resource doing it. Okay. My argument there is if you look at what random testing is meant to do, it's a deterrent, not meant to capture someone in the act. It's meant to deter somebody from doing it in the first place. So my argument against not doing it is, okay, could you afford $500 or $600 a year as a company to have a random program? Most people say yes. Well, I say, well, do this then. Test started on January 1st. Tell everybody we're starting a random program. You test once a week for the first month of January. That's 4 tests. You test once a month for the remaining of that quarter. That's 2 more tests. You test once a quarter for the remaining that year. That's 3 more tests. You've done a total of 9 tests at about a 50, 60 pop for a panel, basic panel. And that's under $600 a year. Okay. So it's worth it to have that deterrent in your workforce to not do things to begin with. Okay. If you look at this from a level of your ultimate goal, what is your ultimate goal? The ultimate goal is to have people not be compromised on the job site. We do risky work to begin with. They have to be clear-headed. I have a couple companies that I've heard of in downtown Seattle that work on the big high-rise commercial buildings, industrial sites, that don't allow energy drinks. No Monsters, no Red Bulls. Too jittery, too much caffeine, too much sugar. Okay, so my point there is legally you can do whatever you want, as long as you're keeping go back to your ultimate goal. You're trying to keep your men and women safe on the job site. So legally, you can do whatever you want. So this is where we talk about marijuana. Marijuana pops up constantly with questions that I have. Well, what do we do? What do we do with marijuana? It's legal. Yes, it's legal. So is alcohol. So my advice there is adopt what the Department of Transportation has adopted, and that's a minimum threshold limit. So this is the RCW right there on the right side under the marijuana leaf. A driver is guilty of driving under the influence if their blood level registers a THC concentration of 5 nanograms per milliliter or higher within 2 hours of driving. It's just a minimum threshold limit that's analogous to the 0.08 blood alcohol limit. And if the Department of Transportation says a commercial driver can drive across I-90 with a level of under 5 nanograms per milliliter, that's at least something. If you feel like you can't maintain a workforce because of any negative test due to THCs. So I'm not judging anything here. I like my really nice whiskey out at the fire pit. It's no different than somebody who likes to eat a gummy or a brownie or smoke something. That's my point. My point is, are they coming to work the next morning clear-headed with nothing in their system? I can't tell me. I know people on this presentation have done the same thing I have, because it happens all the time where you're driving home, windows down, nice day out, and you smell it, and somebody in front of you, and it's usually in a service vehicle, either somebody who works for a municipality or somebody in a construction vehicle. I'm not trying to judge, but I smell stuff coming out of the window. Okay, smell the skunk cabbage. Just because it's legal doesn't mean it's legal while you're driving, doesn't mean it's legal while you're using a power tool, et cetera, et cetera, et cetera. Okay, so adopt at least a minimum threshold limit. Okay, so this goes into what your policy is. Clearly define zero tolerance. Thou shalt not. Thou shalt not use on our job sites. Thou shalt not use on breaks or your lunch break. And you won't come to work or be compromised while you're on our job sites, period. Clearly defined zero tolerance. You should have very loose language on how you react to an infraction of that policy. And here's why. I had a couple employers when I first started teaching this content that had zero tolerance, and in their policy they said any infraction will result in immediate termination. They were forced to get rid of people that they didn't want to get rid of due to circumstances, because someone became addicted to their pain meds, because someone was dealing with some serious stuff at home and they started turning to alcohol and substances and they needed help. Okay. This is different than a kid you just hired 2 weeks ago that tests positive for methamphetamines that he's doing in the porta potty. Okay. Make sure that you have the ability and the right to react as you see fit based on an infraction of your substance abuse policies. Okay. So have clear language on what you should and should not do, and have loose language. We reserve the right to blah, 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 up to including termination when it comes to the punishment of a policy. Does that make sense? Okay. Next is, and you'll get a copy of this in the content along with the slide deck. You're going to get a copy, and I pulled this right off the DOT website years ago. It's definitions of legal, illegal, alcohol, and prescription substances. So it's just a definition of terms. So in your policy, have definitions. What is a legal substance? What are illegal substances, prescription substances, alcohol, et cetera, et cetera, et cetera. It defines all this stuff. And then on there is just some basics on THC, the minimum threshold limit, the 5 nanograms per milliliter, et cetera, et cetera. Okay. Again, supervisor training to recognize when someone's compromised. And that's very basic. It does not need to be a formal training where someone gets their certificate of completion. You can find this online, et cetera, et cetera. And then again, the most important part is the documentation and enforcement of your policies. And this is no different than a disciplinary policy for something else. Okay, showing up on time. Okay, if you're going to draw the line in the sand, hold the line. Again, you have the right to react as you see fit, but you need to document and enforce your policies and procedures. Okay, the standard operating policies when it comes to drug and alcohol use on your website or on your work sites. Excuse me. Okay. The last component, and this is a whole massive topic that I can't go into today, but it really addresses a big trend in construction when we talk about total human health, mental health, suicide prevention. It's all that big ball. It's very serious in nature. Again, we work in a stressful industry in an area world that's expensive, and there's just all kinds of stuff that goes into this. If you want more on this, I guarantee you both Will at ABC and Heidi at the Western Washington ABC and Heidi Eastern Washington Inland Pacific chapter, we schedule these frequently when it comes to mental health, total human health, recovery centric workplaces. It's a massive topic, lots of training, lots of resources. I encourage you, if you have more questions on that, to get in touch with your ABC safety directors, because they're very well tied into that. I've been to probably 4 or 5 of these day-long trainings, and so there's a lot more content to this concept when it comes to mental health awareness and suicide prevention awareness and all that stuff. But I wanted just to address this briefly: is the third component of a strong substance abuse program is an employee assistance plan, an EAP. And it's a work-based intervention program designed to help your workers with issues that may negatively affect their performance or put them at risk. Okay. They're less safe when and let's take the substances and alcohol out of this. They're more at risk when they're thinking about some of the tough stuff going on at home. If they're not focused on their tasks, that's when accidents happen. So have educational resources that are confidential, available to all, not just on substance abuse prevention, but mental health, financial assistance, et cetera, et cetera. I understand that not all companies can afford to subscribe to an EAP through like drug-free workplace and stuff. There are county programs, Department of Social Health Services, et cetera, for King and Pierce counties. I know the East Side has them as well. At the very least, if you can afford as a company to create a program for each employee, make sure you're directing them to those social resources that are available to them through the county and the state. Okay, lists of phone numbers, lists of websites, put them on a laminated card. I have a couple employers, when we talk about this in our safety council, that put these up in the porta-johns and on all of their work sites, so that they have, when they need help, when these guys and gals need help, they don't have to go research where to find it. It's available to them. And then the most important thing is, whatever your plan is, whether it's just a list of websites and phone numbers, or it's a full-on big, beautiful EAP, encourage them to use it and show them how to use it. The companies that do well with this component talk about it in their toolbox talks at least 2 times a year, more like 4 times a year. Did you know you have this resource? Did you know that you have this phone number? Did you know if you need help with this, or this is where you can access it? So just having a plan available to them, if they don't even know where to find it, is worthless. Okay? Encourage them to use it and show them how to use it.